Hello everyone, we are Group 3 and together with my groupmates, we will be presenting a role play. So our chosen case is about meningioma brain tumor, which is a benign type of brain tumor that forms a membrane that covers the brain and spinal cord just inside the skull. Sit back and relax because we will start this instant. A 21 years old woman named Norhana Sabdula decided to schedule an appointment at UZ Hospital after she experienced some symptoms such as seizure, memory loss, and changes in vision, unaware that she is already experiencing symptoms of meningioma brain tumor. Ms. Norhana successfully set an appointment at UZ Hospital and expected to make an appearance on June 13, 2022. Ms. Norhana arrived at UZ Hospital at exactly 8 o'clock in the morning. She headed directly to the nurse's station to ask regarding the appointment she scheduled.
Hello, ma'am. Good morning. How may I help you?
Hello, nurse. Good morning. I have a scheduled appointment today.
What is your name, ma'am?
I am Norhana Sabdula.
Age?
I am 21 years old.
Birthday?
My birthday is on January 6, 2001.
And your address?
I live in Jump Street, 122.
And the date of appointment, which is June 13, 2022. Okay, ma'am. Just wait for a while and let me check it first to see who is the assigned attending physician for your scheduled appointment. All done. Your attending physician is Dr. Raymond J.
Okay.
Now, ma'am, I am going to take your vital signs for your initial assessment. So, your vital signs, your temperature is 35.5 degrees. Heart rate would be 102 beats per minute. Respiratory rate, 19 breaths per minute. Okay, now, you're all good. Just walk straight on that hallway. Then, turn right to see the doctor.
Okay, thank you so much, nurse. Good morning. Is this the office of Dr. Raymond Tige?
Good morning. Yes, it is. May I know what's your name and your concern, ma'am?
I'm Norhana Sabdula, Doc.
Okay, let me hear it, Miss Norhana.
Well, Doc, I have concern regarding with my health. Well, after doing some household chores, I suddenly felt dizzy and weakness both my arms and legs. I thought it was normal, that's why I let it pass. And I just think that I just need some rest. But then, a week ago, my mom found me lying on the floor while having seizure. And also, Doc, I noticed that every time I eat, I can smell the food that I eat. And then I have a bit blurry with my vision. I don't know if that's cases are related.
It's okay. We'll figure that out. It might need a few scans including a head CT. Any signs of forgetfulness, ma'am?
Well, Doc, yes. I actually forgot things easily more often. And also, Doc, I experience often having a headache, which is, I think, it is not normal. And I'm worried, Doc, that I might have some serious illness, which is really my concern. That's why I set an appointment here today. Wait, Doc. I think my head is aching.
Nurse, help! Somebody get a gurney in here!
Two nurses rushed with a gurney to assist the patient. The patient has collapsed and the doctor decided to put the patient on admission. And a series of nurses have provided some due care to the patient while it is unconscious.
Hello, ma'am. I'm Nurse Mikey. You're admitted at UZ Hospital right now. You passed out earlier and Dr. Tige decided to admit you to treat you and observe you closely. Okay, may I ask for your name, ma'am, and how are you feeling?
Oh, I'm Norhana Sabdula. And well, I still feel a bit dizzy, but I'm feeling better than earlier.
Okay, that's good, ma'am. And I have just administered you some fluids through IV that Dr. Tige ordered for you to regain your strength.
Okay, thank you so much. But wait a second. Who is Dr. Raymond Tige? May I continue to talk to him?
Yeah, sure, ma'am Norhana.
Nurse Mikey then called Dr. Stige attention to let him know that the patient has regained consciousness.
Hello again, Ma'am Norhana. You had a seizure earlier while we were having a discussion. And in order for us to know why you're having the symptoms, we will have to conduct a few labs tests such as MRI and head CT. This will help us have a better look at your insides and also take pictures of your brain from different angles. All these tests will help us identify your condition and come up with an accurate diagnosis. So, what can you say, ma'am?
Okay, Doc. Okay, Doc. I'm all in. I just know what you must do.
One thing prior to a CT scan is that you're not supposed to eat or drink 4 hours before the head CT. That's why I ordered to give you some fluids that Nurse Mikey administered. It's been 3 hours since you have passed out, so I might be back in an hour. And for now, ma'am, Nurse Christine will come in and assist your vital signs and prep you for the scans later, okay?
Okay, Doc. Thank you so much.
After the conversation of Dr. Tiga and Mr. Hannah, a nurse came into the room to take the vital signs of the patient.
So, hello ma'am, I'm Christine. I am a nurse for today. So, may I know your complete name, ma'am, and also your birth date, ma'am?
Hi, I am Norhana Sabdula, and my birthday is on January 6, 2001.
Hello, ma'am Norhana. I'm going to quickly check your vital signs, which includes the blood pressure, the pulse rate, the respiration rate, and also the body temperature, as well as your height and weight. Is it okay for you, ma'am, if I'm going to get your vital signs?
Okay, I understand. Go ahead.
Okay. So the vital signs that I get on you, this is the result, ma'am, that I get on you, the vital signs. The body temperature is 37.2 degrees Celsius, and also for the pulse rate is 80 beats per minute, and also for the respiration rate, 14 breaths per minute. This vital signs, ma'am, this all results that I've given to you, it is a normal result, ma'am, which is a good sign of your health. And also for the height is 5 flat, and also for the weight is 47 kilograms. So that is all for the vital signs result that I've get on you, ma'am.
Nurse Christine has carefully assessed Mr. Hannah to get the accurate vital signs that are also considered as the primary data that are necessary to help identify her condition later on. While the patient is waiting for the schedule of the lab and scan test, the attending physician is using a computerized provider order entry to enter orders into the medical record for the laboratory and radiology orders needed for Ms. Norhana. Dr. Tiga, along with the nurses, went to Mr. Hannah's room to inform her that she will now be escorted to the radiology room for the scans.
Hello, Mr. Hannah.
Yes,
Are you ready?
I am, Doc.
Okay, we shall go now.
While Mr. Hannah is being brought to the radiology room for a scan, her parents arrived at the hospital looking for her and warded sick.
Hello, good morning. How may I help you? Hello, my daughter went here to get checked up this morning, and I was informed that she collapsed again. Is she okay? Where is she? Okay, ma'am, just breathe and try to calm down. What is your daughter's name?
Norhana Sabdula, nurse.
Okay, your daughter is doing fine and she is now being brought to the radiology room to perform reviews test. You can just head to this direction. You'll see the CT scan room right there. Okay, ma'am, thank you. The radiology room asked about their daughter, and we're told to wait in the imaging suite while the scan is being performed. Hello, ma'am. I'm Shikaya, and I'm here to assist you in getting into the machine comfortably. You don't have to worry about anything because all you have to do is to lie down. It shouldn't hurt, and you're gonna feel anything. It's just like lying in bed for a couple of minutes, okay? After 10 to 30 minutes, they're finally done with the head CT, and afterwards, they went to the other room for the MRI scan. When they arrived at the MRI scan room, Mr. Hannah is assisted by another radiographer, while her parents are waiting outside the room for her. So hello, I'm Monique Johandala Suarez. Since you're done with your CT scan examination, let's proceed for your MIR scan. It's actually quite the same with what you did in the previous room. So are you ready?
Yes, I'm ready.
Mr. Hannah successfully finished the 2 laboratory tests and then rested another day at the hospital while they are waiting for the additional instruction from her attending physician. A day later, Mr. Hannah received an information from Dr. Tige stating that she was scheduled for a blood testing and biopsy. 5 days later, the physician was already informed Mr. Hannah of her condition. After almost 1 week of assessing her physical examination and laboratory testing, the results were being collected and examined by a neurologist, radiologist, and her attending physician himself.
Hello, Ms. Norhana. After a few weeks of examining, we finally have our diagnosis. And for your condition, together with other doctors and help from our nurses, we found out that you have a meningioma brain tumor.
Oh my god. Am I gonna die, Doc? Doc, help me. Are there any solution or treatment for this illness, Doc?
You need not to worry, Ms. Norhana. It's a benign tumor that forms a membrane that covers the brain and spinal cord, just inside the skull, meaning it's not entirely that bad. The surgery will be the best option. We will remove the tumor and some intervention like radiation therapy may also be done. There are medications that I will prescribe to you to prevent it from recurring, and we will be monitoring you from time to time. We will do everything that we can do to provide you the best care that you need. For now, you just rest and wait for a schedule for your surgery. So, will you approve that we do the surgery?
Yes, Doc. We'll do it. Just do it.
Dr. Tige, with the help of a neurologist and other surgeons and scrub nurses in the operating room, have all worked together to remove the tumor from Mr. Hannah's brain, and it went successfully. A few months later, and Mr. Hannah is now in recovery and have been maintaining the medications given to her to prevent the meds from recurring, and have also been having a monthly checkups to ensure that she's doing well and not having complications from the surgery.